eye surgery did Joe Jonas have? If you're interested in finding out, keep watching. Hello everyone, I am Dr. Rupa Wong, board certified ophthalmologist, and on this channel we talk about eye health, eye surgery, and a little bit of eye makeup health. So if any of that interests you, make sure to hit the like, subscribe, follow, do all of the things so you can get this content as soon as I make it. So let's get back to Joe Jonas. I am an ophthalmologist, which means I'm an eye surgeon. However, I do not perform the exact surgery that he received, but I know enough about it, and surgeons at my eye surgery center do perform it, so I tapped them for some hidden gems and pearls of wisdom. So let's get to it. So Joe had the Visian implantable collamer lens, also called ICL. He has talked about how he was nearsighted or myopic since he was young, and how wearing glasses and contact lenses was a big pain, especially when acting and performing. So that's why he was intrigued by this particular surgery. So this procedure is for individuals who are nearsighted, and it can also take care of astigmatism as well. So I'll go through the exact patient criteria in just a second. But Joe is not super nearsighted. He's not a high myope. His prescription is under -5, so he was considered an absolutely ideal candidate for this particular procedure. It takes about 20 to 30 minutes per eye, and afterwards he said he could see perfect. Okay, so what exactly is this ICL? So basically, it's a lens made out of a flexible polymer material, and where it's put is it's actually injected into the eye between the iris, which is the colored part right here, and the lens. So there's a little space right in between here. That's where the ICL is implanted. So since it's inserted in the eye, it can actually be removed if you ever want to at a later date. So that's one of the distinguishing factors between ICL surgery and LASIK. In LASIK, what happens is the cornea, the tissue is removed permanently from the cornea. It's cut away using the laser, and you cannot put it back if you have any kind of complication or too much cornea was removed. That cannot be reversed. So who is this good for? So this is good for individuals who are nearsighted and who might also have some astigmatism, but your glasses and contact lens prescription needs to be stable, so it shouldn't have changed more than a half a diopter in the past year. It can take care of nearsightedness or myopia in the range of -3 to -16 and 4 diopters of astigmatism. So that's a good amount. It is FDA approved for people who are aged 21 to 45 years old, so not older than 45. So if I was nearsighted, I would not be a candidate. And it's also great for people who are not good LASIK candidates. Either their nearsightedness is too high, their corneas are too dry, there's going to be too much tissue removed from LASIK. So if you're not a good LASIK candidate, then ICL might be an option for you. So one of the first studies included 210 people, and 97% of them got basically within a line of 20/20, which is great. And there were very few complications. One of them was that the lens that gets put in the eye rotated a little bit. And for that, then you just have to go back to surgery and they will reposition it. And then another study, which looked at 83 people followed for 5 years, found that 95% of them had 20/25 vision or better. So again, pretty good. So how else is EVO ICL different than LASIK? So EVO lenses can permanently reduce nearsightedness without removing the cornea, and it is reversible. It's a little bit more invasive because this is actually intraocular surgery. So there's a few more steps involved versus just LASIK. So because of that, it takes a little longer, about 10 minutes longer than LASIK, and it costs more, ranging about $5,000 in most cases. So anywhere from 1.5 to 2 times the cost of LASIK. So is it safe? It is safe. It is FDA approved in the United States. And even though it's a new FDA approval here in the US, it's been implanted in other countries for a very long time, specifically in Europe, Asia, and the rest of the world. There have been over 2 million ICLs implanted. So it's not just the couple hundred that I discussed in the studies. This has been used in many, many people, and over 99% of the people that have it done said they would do it again. So what's the procedure like? Well, usually, just like LASIK, you have to stop wearing your contact lenses for 2 to 4 weeks before the procedure. You go into the office, they put numbing drops on your eyes, and then they'll insert a lid speculum, which is what keeps the eyelid open. Then they'll make a tiny micro incision into the front surface of your eye to be able to implant the ICL. And then afterwards, you will likely have a patch or shield until the following day. Typically, you're going to be using antibiotic and steroid drops to prevent infection and inflammation. So what are the risks of this surgery? Well, like anything, like any kind of eye surgery, we always have to say there's a risk of blindness because we're operating inside the eye. There's risk of potential vision-threatening infection called endophthalmitis. You might get undercorrected or overcorrected, in which case you would need a second surgery to fix that issue. There can be inflammation in the eye, bleeding in the eye. You can even get glare or halos. And then the possibility of increased eye pressure or glaucoma, damage to the retina, and the development of cataract. So middle-aged men who are nearsighted have a higher risk of developing cataracts. So if that's the case, then usually if a cataract develops, that's when the lens in your eye becomes cloudy, then another surgery would be required to take that lens out, and that's going to shift how well you see if they put in an artificial lens, because you might not be able to read as well if you have a cataract and have that removed. It's also possible to damage the cornea and macular swelling. The macula is the part of the retina which is responsible for your fine central vision. So if it gets swollen, you really do notice it and it impacts you. But just talking to my friends that are surgeons that have been doing it, they are loving the results. Their patients are really enjoying it. How did these surgeons get certified? Well, the company sends a rep and watches them do these surgeries. And after you do, I think 8 or 10 surgeries, then surgeons can get certified and start doing these ICL surgeries on their own. Like any surgery, you want to find someone that's done a lot of the procedure because you want someone that knows how to handle the complications. The surgery in and of itself is not extremely complicated like some of the other types of surgeries that we do in the eye, but you want to make sure you are with someone that knows how to handle if something goes wrong, how to fix it. So there you go. That's what Joe Jonas had. Evo Visian implantable collamer lenses, or ICL for short. You can check with your ophthalmologist to see if you are a candidate or if there's benefits for that over LASIK and which one you choose. I hope that was helpful. If you have tried the ICL, I'd love to hear from you. Drop it and comment below. Let us know your thoughts and your experiences. And if anyone's interested, also put that in the comments. I'm sure there's a community of people here that can recommend good surgeons as well. And until next time, it was good to see you. I'm Dr. Rupa. Bye-bye.